Hey folks, it's Rena Jadov here, and I've got with me today Dr. Cerra. She's a naturopathic doctor and expert who is focused on women's health, especially, and this is the part I love, teen health. Teen health, mental health, and today we're going to talk about this crazy invasion of sickness and disease and anxiety and depression and phantom aches and pains and autoimmune issues in students in high school and colleges. So many of the college students are taking time off, coming home, taking a year off. They're having gut issues, they're having stomach issues, digestive issues. And of course, as they get older, they start to develop these autoimmune issues. So Dr. Cerra is here with us today to help us get to the bottom of this so we can all lead amazingly healthy lives. And again, if you're a parent of a teen, you're going to want to listen to this and then hopefully get your child to listen to this as well. Dr. Cerra, welcome.
Thank you so much. And thank you so much for that wonderful introduction. I'm elated and so excited to be here and to talk with you today. And yeah, I'm excited to get into this information. It's such a passion of mine to help the young adults, whether they're going into college or while they're in college, just have that strong foundation of health so that they can then go forth and do all the things that they care about and focus on their studies or their athletics or whatever they're passionate about, and not have health be an obstacle to cure in that department.
Absolutely. Let's talk about why are these kids getting sick? What is going on?
That is a great question. So when I see my adolescent patients, or any patient for that matter, there are what I call my determinants of health, things that I want to make sure are in check and that are being completed out and fulfilled properly. And that's patient sleep, their diet, their exercise, their water intake, what their stress levels are like, and their bowel movements. And if all of those things are working in proper accordance, then there's other things to investigate. But that's what I call my foundations of health and things that should be in alignment. And for the most part, college students, they're not sleeping correctly, they're not eating correctly. If they're exercising, they might be over exercising and not exercising the right parts of their body that they should be. The quality of their water, I can't imagine is that great. And also the amount of stress that they are under in those first few college years is very extreme when compared to when they were living in a household that was most likely nurturing their environment for success. So those are all areas that I work with my patients. And once those are all in proper accordance, disease or illnesses seem to go down and disappear. So those are the main things that I focus on with those adolescents.
All right, well, let's go down that list. Let's start. What is, of the ones you've mentioned, if you had to start with one, what is the absolute most important thing that every teen needs to get sorted out?
Sleep, for sure.
I couldn't agree more.
This
Yeah.
is, I mean, I could talk about sleep for 5 hours, but we got a limited amount of time here today. But I'll talk to you about it in a few things in regards to our cognitive function, in regards to our immune system, and in regards to our health and um, our pain tolerance. Really quick, there's this awesome study that was done that showed people who had less hours of sleep in the night, they then tested them the next morning, and those who had more sleep were able to hold their hands in ice cold buckets of water for a longer amount of time. And this is really key for patients who are suffering with autoimmune diseases that cause pain, because once they have their increased amount of sleep in their life, they don't experience those achy joints or painful muscles or those migraine headaches as much as if they weren't getting their right amount of sleep. But something for college kids that's really, really important with sleep is the impact that it has on our immune system. So while we're sleeping, our immune system releases these proteins called cytokines, which help promote sleep sometimes. And these certain cytokines are needed to increase when we have an infection or any inflammation, or when we're under stress, they also are released. And with sleep deprivation, we don't have these cytokines being released. And so when our body is trying to fight off infections or fight off illnesses or combat stress, we aren't able to do so as adequately as if when we're getting our 8 or 9 hours of sleep. There's also so many studies that show the importance of sleep with cognitive function and being alert, which we know if we only get 1 hour of sleep, we're not going to be awake and really fully 100% there to tackle our exams or our homework. Another study that was done showed that when we had daylight savings time and high school students were driving to school, when they cut the clock back, I think it's falling back, and got 1 hour of sleep, there was a huge increase in car accidents. And it's shown that less sleep and driving is worse than drunk driving. And I'm not promoting drunk driving at all. I'm just saying that that's how much a lack of sleep can affect your cognitive function. It's really, really bad. So
Mm-hmm.
my number one thing for everybody that I see is to have a set bedtime and to have things that they do, whether that's a nighttime routine or if they have to take certain supplements that they've talked to their, provider about taking to get them to fall asleep on time and getting those 8 to 9 hours of sleep, and that they are able to wake up feeling rested. I would say so many of my patients, they come in and they start seeing me and I ask them how they feel when they wake up in the morning, and gosh, I'd say over 90% of them say they don't feel good or they don't feel ready to take on the day. And that's something that I'm like, okay, my goal is for you to wake up and feel ready and capable and excited to take on your day. And there's so many factors that go into getting a proper and healthy sleep. And that's my number one thing that I would say that would
How
help.
many hours of sleep should a teenager be getting?
8, a minimum of 8. And I know, late high school years, so like 15 to 20, you feel like you can run on less hours of sleep, like maybe 5 or 6, but it's still so imperative that they're getting a minimum of 8 hours of sleep.
Now, you were in college pretty
Right.
recently.
Yeah.
How did you pull it off? Because when I've had this conversation with my 20-year-old, she says there's not enough hours in the day. There's no way that I can sleep.
Yeah, no, I can't, gosh, it'd be a hypocrite for me to say that I was sleeping 8 hours a night when I was in college. But recently when I was in medical school, I was most definitely making sure that I was getting my 8 hours of sleep. And the way that you're able to pull it off is you are able to function at such a higher level of whether that's physical agility or mental agility when you do have those 8 hours of sleep. And if you were to compromise and maybe stay up 2 hours past your bedtime, you're only really functioning at perhaps maybe 30 to 40% of brain power as you would if you just went to bed and then did that work the next morning. So I think getting a tutor or a classmate or a professor to help you figure out how to use your time management most effectively, because that's one of the main things when I hear kids saying, there's not enough time in the day to get my 8 hours of sleep, I can't do it. Well, then it's taking a look at your calendar and seeing what are you doing from 7 a.m. to 7 p.m. And once you've taken out the classes and you're only looking at their free time, you probably have I don't know, every college kid's schedule is different, but then you're looking at maybe 5 or 6 hours in the day where they are studying, but are they really studying, right? And it's making sure that you're helping them use their time effectively. And that means no cell phones while they're studying, no internet when they're reading their textbooks, and no distractions. And so when people are saying there's not enough time in a day, well, then it's kind of dissecting, or not kind of, it's really dissecting and looking into how they're using their time and how to more effectively go through their day so that they can get that sleep, and figuring out what the obstacles are that make them feel as if they do have to stay up until 2, 3, or maybe 4 a.m. to get their work done.
I think it's also a great opportunity to reprioritize, because there might be way too many things on the plate. There might be too many clubs that they've joined. There might be too many social engagements. There might be projects. I think there's personality types that also overcommit and overdo in learning, that it's not a question of how much can I do and not sleep. It's more about how do I make sure that I'm asleep at this time to this time. And then I only do things that fit in my schedule around that. And I think that's a skill that isn't taught. No counselor ever sits down with a teen and says, let's help you reprioritize. Why are you doing these 4 things? And I like them is not a good enough answer.
Exactly.
How do you, I think it's just so important, because we know for a fact that lack of sleep leads to anxiety, depression.
Mm-hmm.
It leads to weight gain. It leads to creating a broken sleep cycle, which means you end up with insomnia for life, because now you've just completely broken your melatonin cycle. And it creates autoimmune. We know that. So,
Yep.
so number one, you are saying pick a time to sleep, turn everything off, get your 8 hours, and fit your life around that. What's number two?
Number two is, oh gosh, this is a toss up between what their diet looks like and what their mindfulness and stress resilience look like. But I would have to say what their diet looks like is my number two.
I would have gone with stress, but okay, let's look at their diet.
Well, we can talk about stress too. So, it might be stress. I see a lot of patients with eating disorders, and I work a lot in that field. So I think I have a big pull to making sure that my patients are getting properly nourished in the health department. But if I zoom out and I look at the big population, I think you're right in saying that stress is something that's really important, and creating a resilience to not be stressed out. At least for me, with a personal history, every time when I was an undergrad, whenever it was exam time to come around, I would get knocked down with strep throat every single cycle, every quarter. And it was 100% stress related. So let's talk about stress.
So let's talk nutrition, and then we can talk about stress. So
sounds great.
Nutrition. We know they're living either off of really crappy, toxic college food, or they're ordering in, right? These days, that's the new thing.
Yep.
Neither of which are great. What do you recommend? What are the core factors of nutrition that these teens need to keep in mind as they run around their day?
Yeah, of course. So when I talk about food with my patients, I talk about the Fab Four in every single meal, and that is having a majority of their plate being leafy greens. Then the Fab Four is leafy greens, starchy vegetables, a protein, and a healthy fat. So leafy greens meaning their spinach, their kale, their romaine lettuce, whatever their leafy green is, and then a starchy vegetable. So carrots, sweet potatoes, Brussels sprouts, broccoli, asparagus being another 15% of their plate. And then the last tiny portion, about 7% each, being a healthy protein, whether that is from an animal protein that is a high quality, grass-fed, organic animal protein, or if they're vegetarian or vegan, doing a high quality protein there, or a healthy fat. So having nuts and seeds or avocados or coconut oil being a part of their meal. And every single meal has to have those four components. You can't just have a piece of protein and think that's a meal, or you can't just have the green juice and consider that a meal. Like, every meal needs to have those four components, and they have to be eating 3 meals a day, because this will go into when we talk about stress too, but to create health, our body has to be able to feel safe. And if our body doesn't know when the next time we're going to eat is going to be, it's going to feel stressed out. So every day, eating at the same time, going to bed at the same time, exercising at the same time, having the same mindfulness exercises throughout the day can create a routine where our body feels safe. The same way when we have babies, we feed them the same time, they hopefully take naps at the same time. I know it's a toss up there too, but you put them to bed and wake them up all at the same time, because we're creating an environment where they're feeling safe in. And I like to talk about that with food as well. So eating 3 meals a day, having those 4 components in those meals is very, very, very important. And then if you want, I know it's so hard to stay away from indulging in desserts and sweets and caffeine and alcohol in those college years, but really limiting those and enjoying them in moments of time where you don't have exams or you don't have stressful things coming off, so that your body is able to take them in and digest them. And it's no longer going to be such a taxing thing as if you were moving through in a stressful exam week, or in a period of time where you can't compromise your health, because sugar and alcohol and I can go into a lot of things that we shouldn't be putting into our bodies, but those things really do have detrimental effects on us and cause inflammation, and do cause us to be sick much easier.
Where do fruits fit in?
Oh, fruits fit in. Those fit in for snacks and throughout the day. I think fruits are really, really great. It gets tricky because some people will take fruits and eat so many of them. They are high in sugar content. I'm a huge advocate for fruits though. So if you're eating a fruit, pairing it with a healthy fat like apples and nut butter, or a banana with some pumpkin seeds, and having a binder there for it to help properly digest the sugars that you're putting down.
So we know how hard it is for these students to eat 3 meals a day.
Yes,
And
yes.
we know that a lot of these students, the first meal of their day is actually coffee.
Hmm.
Have you seen the science around kind of coffee on an empty stomach? And what are your thoughts about coffee being the first meal of the day?
Gosh, I have a lot of thoughts on that. I think for young adults, I mean, for any adult, caffeine first thing in the morning can really jolt our system. And I could also talk for hours about hormones too, but in taking that early morning caffeine, we're really messing with our body's own effect of releasing cortisol, and cortisol is our stress hormone. And it has its own cyclical pattern throughout the day. And in the morning, it is naturally going to be high and
Yeah.
rising. And I do know that long-term drinking of coffee will mess up that natural spike in cortisol to the point where you're no longer able to function without having that morning coffee. And also for gut health, putting that coffee first thing into your stomach, for most people, it can be pretty disrupting and can cause diarrhea or having to go to the bathroom right away, or really mess up our gut lining down there. So if you want to have coffee, I talk about having it either after your breakfast or mid-morning, and giving your body its own chance to wake up and digest some other nutrients in there first. But go ahead and tell me about what you're going to say
Yeah.
about coffee.
No, that's exactly. There was a new study that came out that talked about how incredibly toxic coffee is on an empty stomach, how it completely brutalizes the lining and the stomach, and bingo, creates this cortisol overlay, which your body just doesn't need at that age anyway. We're already stressed. The last thing you need is stress on steroids, and then that does mess up your sleep cycle. It's literally the worst thing that kids can do first thing in the morning, but they're so tired that they think that's what they need. And I've said this over and over again: try a smoothie with the right ingredients and you will feel more awake, more alert than you can ever imagine.
Yeah.
But it's a question of branding, right? Coffee's just got a better branding. We're shoving coffee in television, on ads, Starbucks. We've made it as if that coffee is the morning breakfast, and it's our fault. We've allowed this to happen, and I think smoothies need a better PR machinery.
Yeah, they need to have a comeback, because
Yeah,
they were kind of cool a couple of years ago, and coffee has become very aesthetically pleasing, right? Post photos on Instagram and Facebook of you studying with the coffee nearby, and you go on coffee dates to meet up with people that you're friends with, or maybe like checking out romantically. And it is like kind of the new morning alcohol, I would say. It's very
yeah.
for our kids and for the
It
population.
I love that. It is the morning alcohol. It really
I've never said that before, but I love it now too.
yes, it's the morning alcohol, and it's just as bad. So, okay, so that's on the nutrition. What are your thoughts on organic versus non-organic, and then gluten and dairy?
Oh, that's a great question. So, organic and non-organic, it is so important, if financially you have the means to do so and the resources to purchase organic fruits and vegetables, and produce as well. If finances are a restriction for you, check out the Dirty Dozen and then Clean 15. Are you familiar with that?
Absolutely.
Yeah, I think that's a great resource for people. So the Dirty Dozen means it's the 12 fruits and vegetables that no matter what, you should always buy organic, because they're absorbing the pesticides and the chemicals that are on them much, much more so, and they're more superficial on the fruits and vegetables. The Clean 15 are the fruits and vegetables that you can get away with if you aren't purchasing them organic. So I always advocate for getting organic, because these chemicals and these pesticides that are in or on these fruits and vegetables, they come into our body and they are messing with our hormones. They are messing with our immune system. There are toxins that can affect our brain and the way that our neurons are working. And it's just so sad to me that it's even a thing that we have to think about buying organic or not organic.
And for those of you who are listening in and you want to know what these are, for example, apples and strawberries are on the top of the list, but this list changes every year and it's published by EWG. Just Google Dirty Dozen Clean 15. 2020 is around the corner. Make sure you get the 2020 list. And it's an absolute no-brainer. You mentioned financially. There's an organization called, I think, organic.org or organics.org or bioorganics.org, but they did this survey and they found that the amount of money we're losing when we get sick, the amount of people that are going bankrupt when they get sick, that it's actually financially better to eat organic and not get sick.
Yep.
Because in America today, I think the third cause of bankruptcy is actually medical bills. So I really think that there is no excuse for anyone to eat anything other than organic. But you're right, there is a clean 15 list, and if you don't have to, there's no reason. For example, avocados, you can definitely get away with eating non-organic avocados, and so that's typically. I'm so glad to hear you say that. What about gluten and dairy?
So gluten, dairy. The way I practice with my patients, we always start off our first 1 to 3 months working together with no gluten and no dairy. Dairy is such a huge cause for inflammation in the body. For adolescents, they'll see acne or irregular menstrual cycles or bloating or constipation or diarrhea. And just by the simplicity of removing dairy, so many of those things go away. Gluten is another thing that I like to have patients off of for a little bit. And, a lot of people think it's just like a trendy thing that healthcare providers are asking them to do. But gluten has been shown, and Rena, I'm sure you know the information on this, as a huge cause for leaky gut, which is then a huge cause for autoimmune disease. And especially patients who have autoimmune disorders in regards to the thyroid. I don't know how much time we have to go into detail with this, but the gluten, the tiny little molecule that it breaks down into our body, looks very similar in our body as our thyroid tissue. And so people who have autoimmune thyroid disease, when we eat gluten, our body then is signaled to then go and attack our thyroid tissue because they think it's an inflammation and a reactivity response that has to happen. So gluten has also been shown to be super inflammatory for many other autoimmune disorders and other diseases that can occur in our body. So in college, it can be really, really tricky to be gluten-free, but I like to have my patients eat as much whole foods, plant-based foods as possible, and stay away from gluten and dairy.
Mm-hmm. And these days, there are so many wonderful alternatives to gluten. There's just no reason anymore. There used to be, anyone born 20 years ago, I think it was a lot harder, but organizations like Simple Mills, like you can get crackers, and then there's great bread, gluten-free bread. You can't even really tell the difference. Most restaurants now offer gluten-free crusts. Not all gluten-free products are good, by the way. You do have to read ingredients. There's a lot of crap out there masquerading as gluten-free, and sometimes even worse. But if you look at something like a Simple Mills product, it's just almond flour, basically. It's almond flour, tapioca, cane sugar, and boom, you're done. There you can get cookies and crackers and pizza dough mixes. And so there's really no excuse these days, I think. I always put it down on, we all do what we're used to doing. And so change is hard, right?
Yep.
That first change is hard. Once you've made that change and you've made that commitment, it becomes so much easier. We as a family tend to be gluten, dairy free. Food sensitivity testing is the one thing I tell everybody. Just get it done. Find out what's going on with your gut, because that's just so important. All right, let's talk about stress. That's number 3.
Absolutely. So stress and stress management and stress resilience, this is a huge claim to make, but I would say removing stress is one of the top 3 important factors in creating health for people and for patients. And when we're under stress, I think back when we were cavemen and when we were living life, when we didn't have housing or protection. When we felt stressed, it was because we were either running from a tiger or running from a bear or protecting our kid because it was below 20 degrees out and we had no warm clothes to do so, our body still to this day, if we're about to take an exam, or if we're stressed out studying for something, or if we're giving a speech, or if we're about to have a difficult conversation with someone we're in a relationship with, our body still acts as if we are running from a tiger or being chased from a bear or living in a cave. And if we can do everything we can to calm down the way our body is physiologically reacting to a stressful event and not send off those rapid fires of cortisol or releasing the blood sugar or increasing our heart rate or increasing the way that we're breathing, we can then decrease any adverse effects that could come from what could physiologically be happening from a stressful event, which is could be as everyone perceives stress differently. One patient might think that taking a test is not stressful and somebody else could react to it much greater. So depending on what a patient is and what they're stressed out about, it's finding out what are the top 3 causes of stress for each person, if it's finances or relationships, or if they're stressed out like they can't sleep, and seeing what we can do to calm down those stressors in their life, because having an increased stress does create more room to getting sick. It does create more room for disease and chronic illness to come into our life, and it just creates an unhappy person, right? Mental and emotionally. If we're stressed out, we're going to be sad and depressed. We're going to be anxious. We're going to be moody and frustrated and aggravated and not be able to act in a way in the world that we hope to be presenting ourselves in.
So what would you recommend are 1, 2, or 3 top stress busting things that actually work?
Absolutely. So we just talked about eating healthy and sleeping, and those are my top 2 things. The next few things are moving and having community support. So when I say moving, I mean exercising in a way that you feel good in your body, whether that's dancing or a high intense interval training workout or going for a run or going for a hike. There was a study done, back in the day that showed even just 1 hour of exercise 2 times a week improves adolescent school performance. And the moment in time where you think, I don't have enough time to exercise, that's when you need it the most. That's when you need to give your mind a break from all the schoolwork you're doing, all the emotional stress that you're under, and just release any extra energy through movement and through extra blood flow and just, boosting those exercise endorphins. And then the next thing that is really, really important is having support. So having friends or a therapist or a doctor or a family member that you're able to lean on and talk to, and so that you feel supported in whatever journey that you're on, as well as personal time too. So some people feel fulfilled after talking to a friend. Other people might find that they're more introverted and feel more fulfilled after a few minutes alone, just journaling and releasing their mind in that way. So after diet, sleep, I would say exercising, and then support, whether that's your own personal support through alone time or through support through a community of friends and family members or a mental health provider.
What are your thoughts on meditation?
I love meditation. Every single one of my patients that I see, they are meditating throughout the week. And it's a non-negotiable for me if I'm seeing you as a provider that you are meditating. My goal is to have 30 minutes of silent meditation in the morning, but we start off slow. So 2 times a week, we'll do a guided meditation for maybe 10 to 15 minutes, and giving yourself that time to sit quietly, to gain control of your breath, to figure out how to calm down any physical stressors that you might find, whether if it's a quick heartbeat or shortness of breath or the shakiness or the sweats that you'll get before a test. Through meditation, you can learn how to bring yourself into a nice, calm, relaxing state. So I'm a yoga teacher on the side of my doctor job, so I'm a little biased in how important I think meditation is, but I would say most of my colleagues that are naturopathic doctors are also on board with meditating at least 3 times a week, if not every single day.
Do you have a favorite type of meditation?
Like I said earlier, I like doing silent meditation. So sitting quietly for 30 minutes and, allowing any thought that comes into your head to come through and pass by, and giving your body the chance to digest all of your emotions the same way we have to digest our foods and put things in our mouth that go down our esophagus and our stomach and to our intestines. I talk about with my patients that we have to digest our emotions, and if we're constantly moving throughout the day and never giving ourselves that time to sit quietly and think about things that have gone in our lives, whether it happened 20 years ago or happened this morning, just giving your body the chance to properly process any external stressors or emotions or thoughts that are constantly going through your head, and recognizing them. And if you're in a safe space to process things that are coming up for you, or just let them go and bring back to light, this is my quiet time to just breathe and to set my intentions for the day. Like, things that you want to work on, if you're like, I want to work on being selfless today, or if I want to work on creating strength in my body, and really sets the tone for your whole entire day. So I'm an advocate for doing it first thing in the morning, but if you're able to take 30 minutes during your lunch break and do the same thing, then I think that's just as powerful as well. So I like silent meditations, but it can be hard to go from not meditating to be able to sit quietly with yourself right away. So there's a couple apps that I like. I like to use the Headspace app. You can go on YouTube and look up any guided meditations, and it's about finding one that you feel connected with, because I don't want my patients to sit and meditate and listen to somebody's voice that they don't feel is in alignment with them. So once they find a guided meditation that they like, we kind of stick to that same person that they'll use for the next few weeks or months until they get to a place where they can do some silent meditations. Or simply journaling. I think journaling has the same benefit as meditation. Getting your thoughts out on paper and being able to process things that way is also very calming for a lot of people.
Yeah, I love those. I love those. For some people, 30 minutes is too much. I even say 5 minutes.
Oh, yeah, 5 minutes. I would
Yeah,
say.
wake up, yeah, sit down in bed, put on your timer for 5 minutes and just deep breathe. Because again,
Mhm.
sometimes people are like, what? You just want me to sit there and think about what? I don't know. I'm so confused. And so breath work,
Yeah.
just breathe deeply, one nostril, breathe out the other. Just do that for 5 minutes, slowly, gently, just focus on your breath. And a whole new world awaits when you do that, as I say.
Yeah.
It
You can
completely.
take a problem that feels like it's not able to be conquered, and if you sit and breathe, like you said, for 5 minutes, your whole perspective can change very quickly.
Mm.
And
And
especially my patients that, gratitude to, who have panic or anxiety attacks, and if we just sit and do those slow deep inhales and deep exhales, counting to 8 or 10 for each inhale and exhale, it can calm you down instantaneously and bring you back to a space where you can start to look at your problems from a more observational outlook than feel like everything's coming at you and you can't manage it or deal with it.
exactly, you feel much more in control. And
Mhm.
and then I always say, end that 5 minute breathing with just one word of what is it that you're grateful for. And it doesn't have to be something spectacular, right? It can be something as simple as, I'm grateful I just took these 5 minutes for myself. It can be something as simple as that. Because again, people get mired in, oh gosh, I don't know, what am I grateful for? It sounds like such a big deal, right? I need to make this big list. And it's like, no, you're just trying to get to a place where you feel warmth in your heart.
Mhm.
And whatever brings warmth in your heart, and if you're grateful that the world has cute kittens, then be grateful for that. Be grateful for the last cute cat video you saw. Like, it doesn't matter. The point is, you're trying to evoke an emotion of warmth. um, and it can just completely transform how your entire day goes. So we got stress covered. What next?
We got stress covered. And that also, I usually have stress and support and community in two separate things, but we talked about
Mm-hmm.
support and community in there. It's so important that we have either people around us. If you don't have people around you, then books or pets or things that make you feel, like you said, like the gratitude, like warm and fuzzy and comforted, and that you feel supported. The next thing I would talk about is our resilience exercises, which also goes into decreasing stress. So what I consider a resilience exercise is something that fills up your cup and makes you feel like you're ready to then go out and take on the day or anything that you need to do. It makes you more capable of being out in the world around you and not being knocked down so easily. So I like to talk to my patients about having a marshmallow jacket. And when you're working with me, I hope to get you to a place where you can put on a marshmallow jacket, and things that would come at you and maybe hit you and make you angry or frustrated or sick, you get a cold or the flu, no longer have that effect on you, and they just bounce off of you like a marshmallow or trampoline jacket. So things that increase your stress resilience and resilience exercises are different for everybody. For some people, it might be meditating or journaling. For some people, it might be exercise. For some people, it might be calling a friend and venting to them. It might be having an immune boosting tea that you like to enjoy, or, it's different for each person. So resilience exercise next to physical exercise are the top things up there. And then also products and quality of water, if you want to talk about, or if we want to talk about the toxicity of the environment around us and being mindful and aware of the things that we're putting on our body or into our body, are very close to sleep and diet and stress and mindfulness and all of that.
Oh, let's please talk about toxins, because I've personally found that toxic overload is the cause of 90% of our ailments.
Mm-hmm.
So talk about that. What are these toxins? How are we putting them on? How are we ingesting them?
Yeah, that's a great question. And so toxins in our environment, they can be so many different things, from the pollution in the air that we're breathing, the mercury that could be in our foods, or the products that we're putting on our skin or washing our hair with. They could have toxins as well. And the toxins that I'll specifically talk about, since we are tailoring this towards adolescents, and I like to tailor towards women, is what we call the xenoestrogens, which are the environmental estrogens that are in products, such as beauty products, plastics, sometimes in the foods that we eat. And these xenoestrogens resemble the estrogens in our own body. And then once our body is looking at like, oh, we have all these estrogens inside of us, we start to have an interference with our immune system. They can hold on to estrogens in our fat cells and cause weight gain. They are predisposing us to autoimmune disorders. They are it creates a toxic overload, like you said earlier. So, I have certain non-toxic makeups that I recommend for my patients to wear, and cleaning products and fragrances that don't have toxins in them. But being aware that so for like a person on the street that I'm talking to about this, I tell them, anything that you're putting on your skin or washing your clothes in, you want to make sure that you would also eat it, because your body is absorbing it the way you would if you were orally ingesting it. Just by putting it on your skin. So if you're not going to drink your lotion, then I don't want you putting it on your hands. And if you wouldn't eat your perfume, then I don't want you spraying it near your airways or on your body or your clothes. And that kind of puts a light bulb on most people's heads, like, wow, and then we'll start looking at the back of the labels for their shampoos or for the foods that they're eating, and making sure that you can understand every single ingredient on that list. And the second you read a word that you're like, I'm not really sure what that is, that's a pretty good sign that you probably do not want to be using it.
Because I've realized from my own experience how many products are actually bad, I found that it's easier to just go to the ewg.org site, find the brands that are good, and then just buy everything from them. And so that's what I've done. I just, I shop at 100% pure organic, and I do 100% juice beauty products, which are organic. And I go to Whole Foods and I look at the organic brands there, and I don't buy the Chanel's, etc., because when I looked at the ingredients, I was horrified. Yeah. It's a challenge because teenagers want to, buy all the stuff that's showing up on Instagram and want to follow the big celebrities with their new lines, and they're all toxic. How do you convince a teen to realize that stuff is what's hurting them?
Yeah. So I explain to them, it's hard to explain before they do this experiment themselves, because once you do remove all these toxins and you start using the more natural substances, you'll see that if you do anything that is toxic, whether that's perfume or shampoo or hairspray, you will start to feel nauseous or get headaches or get weight gain or get fatigue the second you introduce those back into your environments. But I also explain that 80% of people who have autoimmune diseases are women. And I would say that most of those women have autoimmune diseases because of the toxic load around them. So that's a big motivator for me and for a lot of my patients, is like, you don't want to be in a place where your health is in danger because you used a nail polish or you washed your clothes in a laundry detergent that smells nicer than some other ones might with like that special fragrance. So a big part of what naturopathic doctors do with their patients is being being a teacher as doctor and a doctor as teacher, and teaching them about what could happen with this higher toxic load and how it negatively affects our immune system, and how it can really play such a big role with our hormones as well. Because, a lot of young women, when I'm seeing them, they are trying to regulate their menstrual cycle, and they want to have a healthy body one day, whether that's in 5 or 10 years, to then have a healthy pregnancy and be a healthy mom. And everything that you're doing from, when you're basically a newborn, but also when you then have control of over your own health when you're 17 or 18, has an effect for so many years down the line. So helping a patient understand their long-term health goals. And I sit down with my patients and I talk to them like, where do you want to be in 5, 10, and 15 years with your health? And then once we both have that vision, we're able to then accurately go through and make sure that we're doing all of the right things to get them to where they want to be, and really keeping in the forefront of our minds what our why is in our health journey. And so why do they want to get to where they want to be? And once they know their main goal, it's very easy to not bring in those toxic things.
Absolutely. And as we are all humans, we all tend to wait until things get unbearable and then we make change. So my big call in this interview is, if you're listening and you don't feel good and something's off, these are some really simple tips that Dr. Cerra is giving you. Give it a shot. Go 7 days. Take 7 days and just follow everything she's been, guiding you with in terms of sleep and diet and nutrition, and not having coffee first thing in the morning, and getting your 8 hours of sleep, and not putting things in your hair, face, body that you wouldn't ingest. Just do it for 7 days. See if you feel better. Don't do gluten dairy for 7-8 days. And if you feel better, you'll have your answer and you'll know what you need to keep doing. Dr. Cerra, what about deficiencies? A lot of us face specific issues because we're deficient. I think vitamin D is on the top of the list for women, especially iron, being anemic. I know calcium can be an issue. What are your thoughts on getting some blood testing done, full panel?
Absolutely. So we do a lot of comprehensive blood testing here in where I practice in San Diego. And it's very important to annually, if not every 6 months, look at your blood panels for your lipids, for your hormones, for your thyroid, and for your vitamin D. And like you said, checking in anemia patterns, or looking at your iron. It's super important. And all of these things have a factor in our overall health with our immune system and with our hormone regulation. And, vitamin D, I would say in 85% of my patients, people's vitamin D is below 30. And in a functional range, we like to see it around 70 and above. And that's a very easy fix for patients who are fatigued or getting sick a lot or are feeling depression. So yeah, checking in on your health markers with a doctor near you who would be more than happy to run a comprehensive panel and look at all of those things. In my practice, we look at about 70 different things on a blood test. And typically, unfortunately, an average medical doctor only looks at maybe 10 to 15 if we're lucky. So if you find that improving your diet, improving your sleep, getting in an exercise, practicing mindfulness, doing all the things we talked about today still isn't working, I strongly encourage you to find a health provider in your area who will then look into some underlying causes of what else might be going on.
What about magnesium, by the way?
Magnesium? I love magnesium. I love magnesium.
That as deficiency in a lot of teens. And then what do you recommend?
Yeah, I recommend a lot of people who are magnesium having deficiencies are the ones that are struggling with sleep, and magnesium is so important for our bowel movements, for having healthy sleep, for having a good cognitive function. So there's a couple of supplements that I like for magnesium, depending on what it is that they're struggling with. If it's the bowel movements, if it's the sleep, or if it's for cognitive function, there's so many different types of magnesium to get into our body. So depending on what a patient is going through, then I'll have a good recommendation for magnesium.
Yeah, I find that that's just one of the top ones. Let's talk bowel movement because we did miss that one, and that
I
one's
know.
key. That one's key. So, what's the deal with bowel movement, and what do the teens need to be tracking for?
Yeah, absolutely. So bowel movements are so important for three main reasons. One, to properly digest your nutrients and break them down, to then properly I can't say that word right, properly absorb them, and then to detoxify and eliminate toxins or excess hormones that are in your body. So to have a proper bowel movement, you're going to be wanting to be pooping at least 1 time a day and having a well-formed bowel movement. So that means not any diarrhea. There is no straining or painfulness when having a bowel movement. And looking in your stool and making sure there's no blood, there's no undigested food in it, and just paying attention to the quality of it, and it's not super mushy or really hard. I talk a lot about bowel movements in my practice, and in the beginning it can be kind of uncomfortable for patients to disclose, but you get pretty comfortable when you work with an integrative doctor about talking about what your poop looks like, and whether there's gas or belching or bloating and all that stuff. So I think a bowel movement is a very big indicator into our health, and knowing if we're having a healthy digestion. The same way a menstrual cycle is a good indicator of what our health looks like. You want to be having those at the same cyclical timing and everything like that. So bowel movements are super important. And a quick thing, if you're not having a bowel movement every day, check your water intake. Make sure you're drinking half your body weight in ounces of water a day. And then move on to other ways to induce a bowel movement, whether that's hot water with lemon in the morning, or getting a squatty potty so you can structurally align yourself to have a proper bowel movement. Or maybe you need magnesium, or maybe you need to increase your fiber intake, and maybe you then need to look into why you're not having a bowel movement and getting a stool test done. So I do a lot of comprehensive stool tests in my practice as well, checking in on any inflammation in the gut, checking in on the bacteria in the gut, making sure there's a proper amount of healthy and not too much unhealthy bacteria. So I love looking into bowel movements and investigating patients in that regard too.
I have found, at least for my family, that bowel movement is linked to how much good bacteria you have. And so when you take probiotics like a Terra Flora,
Yep.
Boom, it all sorts out.
There you go.
And the reason, half of or more of all of us are constipated is because we have no great bacteria. And why is that? Because we're taking glyphosate in every meal. Yeah. And so our guts are so battered and bruised. There isn't a colorful, thriving rainforest inside. And so there's no happy microbes in there to eat, digest, take in the toxins. I mean, there's so much new literature on how amazing these little microbes are and how their health drives our health. And, gut, to your point, we could talk for hours on just the gut, just like you could talk for hours on just sleep. And it is all linked. We know that when you have stress, all the good bacteria die. It's incredible how you need to stay joyful and happy for your gut to function properly. So
exactly.
And you need to sleep in order to feel good. And so then your gut function and your bowel is really linked to your sleep. And it's all connected, isn't it?
It is totally all connected. And especially in regards to gut and increasing that good bacteria, I find that a lot of college students are being put on antibiotics and they get sick because that's the only resource they have is at their medical health provider on their school's campus. And they don't know how to investigate what could be causing their sore throat or stuffy nose and recognize it might not be from an infection, but they get antibiotics anyway, and that's going to completely deplete their gut bacteria. And then you're kind of starting from zero and replenishing that healthy bacteria that you were just talking about. So a healthy gut is something that I love to talk about and to make sure my patients have one. And if they don't have one, then make sure they get one.
I love it. So informative. Thank you so much, Dr. Cerra. And hopefully we're going to get you on healcircles.org. And we're going to have you available to different students who have questions directly for you. So if you're watching this and you're a student, check out healcircles.org. And we'll have this interview posted there as well. And go ahead and post your questions and let's get the conversation started. Dr. Cerra, thank you so much for everything you do.
Thank you so much for having me. This was such a pleasure.
And for the rest of you, stay smiling. I'll see you on another podcast.